Hi guys, my name is Pallavi Ghosh and I'm a co-founder of HealthNeedsRx. Today we have a very special episode of Discussing Disparities. I'm joined with two members from our incredibly talented team. We have Pragya Chaudhary and Shraddha Vermula from the Discussing Disparities podcast. Today we are actually going to have a sort of Socratic podcast where we are going to talk about reproductive health rights and disparities. So, as you may know by now, with the defunding of Planned Parenthood from Title X last year, as well as Trump's recent Supreme Court Justice nominee, Amy Coney Barrett, women's reproductive rights, as we know them, are currently under threat and may have devastating impacts on those who relied on Planned Parenthood and the existence of Roe v. Wade for safe and affordable healthcare. So today let's discuss how today's political climate plays a major role in exacerbating reproductive health disparities for not only women, but people in general. Some history behind it and effective ways to address these issues on the individual, local, and global levels. You may know Planned Parenthood as that nonprofit organization who offers safe and cost-effective abortions for women who need them. They offer in-clinic and abortion pills and highly reliable sex education and contraceptives. These services are especially useful for teens and other people who are not in the right situation to support a child. According to Forbes, Planned Parenthood was responsible for reducing the teen pregnancy rate from 117 per 1,000 to about 2.6 as of 2015. And as of 2018, it was about 18.8 per 1,000. So this is significant because it shows how this nonprofit has historically benefited women of different socioeconomic statuses by improving their life opportunities without the burden of childcare or the associated health risks that come with pregnancy. Pregnancy significantly increases a woman's chance of death, and it only gets worse with each successive pregnancy, which is why things like abortions and contraception are so important for people to be able to optimize their reproductive health and also ensure that any children that they plan to have live a fulfilling life as well.
That was a really great introduction, Pallavi. So speaking a little bit more specifically about reproductive health and reproductive health disparities, let's talk about the birth rate. Nationally, the teen birth rate has decreased 40% from 2006 to 2014. However, Black and Hispanic teens still have birth rates twice as high as their white counterparts. The highest teen birth rates are in counties of less favorable socioeconomic conditions, such as high unemployment, low education, and low income. And the higher birth rate counties are clustered in the South and Southwest.
Going off of that, from 2007 to 2015, the teen birth rate was highest in rural counties and lowest in large urban counties, and a lot of socioeconomic disparities factor into this, like low education and low income, few opportunities for positive youth involvement, neighborhood racial segregation, neighborhood physical disorder like littering and graffiti, and neighborhood level income inequality.
So obviously the role of Planned Parenthood is important when it comes to reducing birth rates and minimizing these disparities. So going off on another branch of reproductive health disparities, we have STDs and STI health disparities. People who can't afford basic needs may have trouble accessing quality sexual health services. And racial and ethnic minorities may distrust the healthcare system, fearing discrimination from doctors, healthcare providers, and that may lead to negative feelings around getting tested and treated for STDs.
And going off of that, we see in STD health, there are disparities based on poverty and socioeconomic standing, unemployment, and lower education levels. People who are of lower SES may not be getting the treatment that they need for STDs. Young Black and Hispanic women are most at risk for STIs. And they, as we've seen, may not be getting the treatment that they need. More education is needed, especially on STDs and STIs, targeted towards young adolescents and talking about safe sexual behavior with their partner.
Now, going off of educating a young audience, why is Planned Parenthood important? Well, Planned Parenthood gives people access to affordable birth control and education, regardless of economic status. Death in childbirth and teen pregnancy, contracting STIs, and cervical cancer are preventable. And education leads to less unwanted teen pregnancies. Teen pregnancies were reduced from 600,000 plus at an annual rate, which is important because women under 20 have higher risks for themselves and their babies. Planned Parenthood also provides annual Pap screens and breast exams, which are affordable, and access to abortion services only take up 3% of Planned Parenthood's work.
So it's important to realize that not only does Planned Parenthood benefit women, it also benefits men in other forms. So they offer detection and treatment for UTIs or urinary tract infections. They offer counseling, infertility screenings, as well as screenings for testicular and prostate cancer.
An important decision in reproductive health was the Supreme Court case Roe v. Wade. In 1970, Jane Roe filed a lawsuit against Henry Wade, challenging a Texas law that made abortions illegal except by doctor's orders. This case, a landmark in U.S. history, affirmed that access to safe and legal abortion is a constitutional right.
So obviously, Roe v. Wade was a really important case in history. And if it is overturned, 1/3 of all women of reproductive age in America could lose access to abortion in their state. And abortion is part of healthcare. Illegal abortions used to cause at least 1 in 6 pregnancy-related deaths. And nearly 1 in 4 women in America have an abortion in their lifetime. If Roe v. Wade is overturned, more than 25 million women would lose their access to abortion. This includes 4.3 million Hispanic and Latino women, 3.5 million Black or African American women, 800,000 Asian women, and 300,000 American Indian or Alaska Native women.
Now remember, just because abortion may become illegal or hard to access, that doesn't mean that it's going to stop abortion completely. It just means that there's going to be a higher rate of unsafe abortions because people will still get pregnant and they need a way to get rid of the baby if they cannot support their child or if they're not in the right situation to have any children. So some ways that we may be able to address these reproductive health disparities is to have an engaging conversation with parents, teams, and community leaders in efforts to educate, learn, and participate in teen pregnancy prevention efforts. We can also give proven prevention efforts and resources to areas with the greatest need and easy access to reproductive health programs and services such as Planned Parenthood, who aims to reduce much of these disparities. So for more information about these topics, please visit their website that will be linked below if you need information on reproductive health or if you need healthcare services, etc., etc. So thank you guys for joining me today. We had a lovely discussion. It was really enlightening. If you want to learn more, please go to the Planned Parenthood, like I said, and you can also visit our website. We will be talking about this issue more in depth later. Thank you guys.